Now, you've probably heard of occupational therapy, but do you actually know what it is? Or if it could help you, your child, or even your aging parent? Today, I'm answering the 5 questions people ask me the most about OT, so by the end of this video, you'll know exactly how it works, who it's for, and how it can make everyday life easier. Hi everybody, I'm Dr. Brandy Archie, occupational therapist and founder at AskSAMIE, where we connect people with the tools, strategies, and services that they need to live their best life, no matter their age or ability level. So let's get going. Question number 1, what is occupational therapy? This is clearly the first question. Occupational therapy, or OT, helps you live life. It's all about helping people do the things that matter most to them, what we call occupations. Now, these aren't just jobs. They're daily activities. It could be getting dressed, cooking, working, driving, parenting, hobbies, literally anything, because everyone's life is different. If an injury, illness, disability, or aging makes those activities harder, OT steps in to adapt the environment, modify the task, or build your skills so that you can keep doing them safely and independently. OT is evidence-based and holistic. We look at the person, environment, and occupation all together to create practical solutions for everyday life. Okay, so the second question is, what do occupational therapy assistants do? A certified OT assistant, or COTAs we like to call, are highly skilled professionals who work under the supervision of an occupational therapist. Once the OT evaluates a client and creates a treatment plan, COTAs are often the ones providing the hands-on intervention, leading the therapy sessions, and helping clients practice strategies and exercises. They're experts at implementing the plan, tracking progress, and providing feedback to the OT so adjustments can be made. So think of COTAs as the partners that make therapy goals happen every day. Okay, so question number 3, why is OT important? Who does it help? Okay, OT is important because our focus on purpose improves health outcomes. We help people live their daily lives on their own terms. Now, who do we help? Literally anyone, but I will give you some examples to help make it concrete. Okay, a child's job is to learn and play. So if a developmental delay, sensory processing challenges, or disabilities is making that hard, OTs help create adaptations, improve coordination and strength, and teach regulation strategies. Now, adults recovering from strokes and brain injuries, orthopedic surgeries, or managing a chronic condition need to be independent at their daily life. So we meet them where they are, whether relearning the ability to do simple tasks like brushing teeth, or it's getting back to complex tasks like driving. Older adults want to age safely at home and maintain independence while their abilities might be changing. So we help with both maximizing the body's ability and also accommodating for the challenges with home modifications and new strategies for doing everyday tasks. People with mental health conditions might need strategies to more independently manage their daily life because of the way their brain works. So OTs will teach alternative methods to get complex tasks done in a way that they can then repeat. If there's something you need or want to do but can't do it safely or independently, OT can help. All right, question number 4. Which type of OT is right for me? OT is delivered in a ton of settings, and the right one for you depends on your needs. So pediatric OTs, you'll find one in children's hospitals, early childhood at home services, outpatient clinics, and schools. Inpatient-based OTs are at acute care hospitals, inpatient rehab, and skilled nursing facilities. You can also get OT as an outpatient, where you can find an OT that's in a clinic that you visit for an appointment and then leave instead of you having to spend the night in the hospital or care facility. You can also get OT at home in home health, when you're ready to be discharged from the hospital but not well enough yet to make it to outpatient. You can also get an OT to come over to the house to help you recover. And then there's community-based OT. It's not tied to a traditional facility, and you may find an OT at a community center, in a nature-based setting, or seeing you at home or virtually. All right, question 5. How does OT help adults with ADHD? ADHD doesn't just affect kids. Millions of adults live with it too, and OT can be a game changer. So we focus on time management systems like calendars, timers, and visual schedules, environmental modifications like organizing workspace to minimize distractions, daily routines like creating structure that works with your brain instead of against it, compensatory strategies like using task chunking, checklists, and habit stacking to get things done. It's not about changing who you are. It's about setting up systems that make your life easier, reduce overwhelm, and help you follow through on what matters to you. Occupational therapy is all about practical, life-changing strategies that meet you exactly where you are. If you want to learn more, I have linked resources and guides in the description, including how to find an OT in your area and how AskSAMIE can connect you with the right tools. If this was helpful, please hit the like button, subscribe, and share this with someone who might benefit from OT, because everybody deserves the chance to live life fully, no matter what the situation.